No, thank you.
Recording. Okay, perfect.
Okay.
Welcome, everybody. Here we are at Living Chassidus. We have another incredible class tonight as part of our life skill series called What's Up with My Hormones and What I Do About Them. It's a huge topic, huge topic, especially as a college teacher. I deal with people that are this is the first time that they're having a discussion with somebody, or not the first time, but one of the first times that they really feel comfortable to discuss with somebody about their hormones and what's going on with them. And once they're trying to organize their wedding date, what's up with this, what's up with that? And suddenly it just cascades into an entire conversation of cycles and when it's up and when it's down and which hormone and which not. And over the years, I've noticed that a lot of people struggle with inconsistent menstruation or very painful menstruation or irregularities of different kinds. And when Dr. Ivy was asking me, what should we talk about? I'm like, this is a hot topic. This is a must needed topic. So I want to first start by thanking our sponsor for tonight. Just opening it up. Here we go. It's sponsored by Anonymous. Oh, give me 1 second. It just didn't work out. Let me open. Here we go. Sponsored by Anonymous, dedicated and exclusive everyone to be able to use these life skills in the right time. Yes, and Hashem should bench this anonymous sponsor with only brachos and only good things. Tonight we have the amazing Dr. Ivy Branin. Ivy Branin is a naturopathic doctor and founder of Simplicity Health Associates. She has a degree in neuropathic medicine from Bastyr University. She has a BA in biochemical engineering from Rutgers University. And as a naturopathic doctor in New York City, Dr. Branin does not approach diseases within a one-size-fits-all perspective, but rather sees each patient as an individual with their own potential for optimal health. We are so lucky to have her. And if you want to find out more about her, you can check her website out, simplicityhealthassociates.com.
Literally right now.
So I have only brachas. Thank you, Dr. Branin, for joining us.
Thank you. Okay, so we can get started. So yes, I'm Dr. Ivy Branin. I'm a naturopathic doctor. And I always like to start off any of these presentations with just doing a little bit of background of what naturopathic medicine is, because I think a lot of people have not heard of that. And so naturopathic medicine is a patient-specific system of medicine that utilizes natural therapies and methods to enable our own bodies to heal. And we're very much governed by our principles. Thank you for coming. So our first principle is first do no harm, which is like very similar to what most medical doctors also practice. Treat the whole person. So we don't just look at what's going on with you physically, but what is going on with your relationships? What is your relationship to food? What is your work like? This can all have an impact on health. Doctor is teacher. So obviously with what I'm doing right now, which is teaching, but with my patients also really telling them more about what's going on with their bodies, really explain to them their condition. Prevention is the best medicine. So we look a lot at your family history. What are some things that might come up in your health history? And treat the cause. So I feel like treat the cause is very much a big part of tonight's discussion, because we're going to be looking at hormones. And often we go to a doctor because we have certain symptoms, and our symptoms might be due to our hormonal imbalances. And then lastly, the healing power of nature. So we believe that our bodies are intelligent. They know what to do. We just need to give our bodies what they need so that they can heal. So here's just a little learning objective. So we are going to understand what happens during our menstrual cycle, understanding the function our hormones play, identifying symptoms when our hormones are out of balance, important testing for identifying hormonal imbalances, and the fundamentals for hormonal health. So first off, what exactly are hormones? Like, what are we even talking about? So hormones are basically chemical messengers that are excreted from our glands. And we have all different kinds of glands. We have our thyroid gland, we have glands in our brain, we have our ovaries. And so basically, hormones get secreted when there are either physiological changes or in response to other hormones. And when these hormones, chemical messengers, are secreted, they reach different targets on cells, and they basically tell cells to do something. So that's just like a basic thing when we think about hormones. But I have a feeling that most of you are here because more of this is that you really want to understand what is actually happening during your menstrual cycle. So hormones are involved in our menstrual cycle. And our menstrual cycle is, so first off, when I have patients and they're like complaining about their periods or not getting a period, really what I'm mostly concerned about is not so much whether or not you are bleeding once a month. I'm much more concerned about, are you actually ovulating? So what am I talking about when it comes to ovulation? So ovulation is basically the release of the egg that, under the right circumstances, will get fertilized and will result in a pregnancy. So ovulation is really the key. And so first we want to look at everything that happens before ovulation. So our menstrual cycle is divided into basically 3 distinct parts. The first part is what we call the follicular phase. So this is everything that needs to happen in order for ovulation to happen. Now, interesting is that the follicular phase in general can actually vary greatly in length because it is influenced by so many different things. I think, was it last month or 2 months ago, I talked about stress. So stress can have a big impact on the length of the follicular phase. So basically, the first thing that happens is our brain senses low hormones, basically low estrogen and low progesterone, and basically tells our pituitary gland to first secrete luteinizing hormone, LH. So luteinizing hormone's role in the first part of the menstrual cycle is actually to tell our ovaries to produce testosterone. So testosterone, which I'll get more in detail in a few slides, is a male-like hormone. And the reason it tells the ovaries to start producing testosterone is that another hormone from the pituitary gland, FSH, follicle stimulating hormone, is going to tell our body to convert the testosterone over to estrogen. The follicle stimulating hormone also is going to be telling our ovaries to be recruiting follicles. So follicles are cells that will, if they mature, will become the egg that is ovulated. So the other thing the big thing is, with FSH is really having that testosterone converting over to estrogen. Why do we want that? So we want that estrogen to be produced because estrogen is going to help with the growing of the lining of the uterus, the endometrium, which is going to be there for the implantation of the egg if it's fertilized. But the other thing that estrogen is also doing is it is increasing. Why is it significant that it's increasing? Is that increase in estrogen is then actually going to signal our pituitary gland again to produce a lot of luteinizing hormone. So I don't know how, probably everybody, I don't know.
I'm going to test you at the end, by the way.
So it's the surge in luteinizing hormone that causes ovulation to occur. So these are all the things that have to happen in order for ovulation to happen. Now, once ovulation occurs, you're going to have more estrogen being produced, but we're also now going to be seeing a second hormone really being produced more, and that is progesterone. And this is also why at the second half of our cycle, which is the luteal phase, we see an increase in body temperature. So I'm pretty sure that I don't know, is anybody like testing like their basal body? Oh, okay, so we have one person who is doing basal body temperature. So our temperature rises at the second half of our cycle, and it's a way that we know that we definitely ovulated. The other ways that we would know that we've ovulated is that there's a change in what we call cervical mucus, so which is produced in response to the increase in estrogen. So anyways, we have the increase in body temperature, we have progesterone being produced more to really support the lining that was grown by estrogen. And so if the egg is fertilized and implants, pregnancy occurs, but if it doesn't, basically 10 to 14 days after ovulation, this thing called the corpus luteum, which was produced when ovulation occurred, dies, and then you're going to have a major drop in hormones, and eventually you will have menstruation happening about 2 to 3 days later. So as I said, that the follicular phase can vary greatly in length. The luteal phase, on the other hand, is never shorter than 12 days and never longer than 16 days. So you can usually typically tell based on when you had your period, when you most likely ovulate retrospectively. So now I want to talk more about, let's see, okay, hopefully it, okay, it's not, 1 second. Okay, there we go. Okay, so I'm going to now go in more detail on the various hormones of the cycle. And here I just like this drawing, and I share this a lot with my patients because it does show the connection between all the different hormones and how they're kind of produced. And I'll probably go back to that as well. Okay, so the first hormone that most of us know about is estrogen, and estrogen has a lot of different functions. Its primary function is to really, again, grow the endometrium. It's also responsible for ovulation. It is very responsible for bone metabolism, cardiac function, cognition, and this is why if we have anyone that we know of who has gone through menopause, that they complain about some of these things. And more importantly is, what are some of the signs and symptoms of excess estrogen? So if we have too much estrogen, that's where we're going to specifically, when we think about PMS, very irritable, painful swelling of breasts. You're also going to see conditions like endometriosis and fibroids. All of these are associated with estrogen excess. Now, where does estrogen excess come from? So it's a couple of things. So sometimes we think about estrogen excess because of a relationship with progesterone. So if there is an imbalance between the two, you will get symptoms of estrogen excess. Also, we metabolize our estrogen through our liver. So if there's any issues with liver, also just different toxins. There's also a genetic component. Interestingly enough, is sleep. So night shift workers actually tend towards estrogen excess, and that's actually because melatonin, which I think people have heard of. So melatonin, we need to be secreting that at night, and one of the things that melatonin actually does that a lot of people don't know about, it actually helps to reduce excess estrogen. So not sleeping well also can lead to high estrogen. Now
We make sure to get good sleep a few days before the period, during the period,
all the time. I mean,
if one wanted to be more conscious about it, when would that be? Would it be leading a few days already starting before, or more or less when the period starts?
Follicular phase, luteal phase,
Yeah,
or
which one?
ovulation. When do you want to get your sleep?
That wasn't.
I feel it always because there's also a relationship even with
My question was when does the estrogen and the excess and the melatonin That's my question. Is it like starting to lead up? Because I'm saying like a lot of times the symptoms start a few days before, right? So like,
Right.
is it a few days before? Is it like specifically during? That's what my question is.
So I would say like, again, like, regardless, like really like poor sleep is going to be impacted. So you're still going to be, you can still definitely have excess, like regardless of kind of like where you are in the cycle, like with sleep. So I would say in general, good sleep, and I will be getting a little bit more into that when I talk about the fundamentals of hormonal health. So to your point, it is really just sleep in general is really important for balance.
Because you want to support your cycle, right?
Right.
And even if the symptoms are showing up at one point in the cycle, but you want to support proper estrogen throughout your cycle.
Also, because a lot of it has to do also like what's occurring during the follicular phase. But at the same time, like you also don't ever want to be so like melatonin is like one of those like touchy like supplements for me because it can because also at the same time like you also don't want to suppress estrogen, and so like it can also even throw off your cycle since you're doing it a lot during the follicular phase. But
No, but like sometimes like during like let's say sometimes people get their symptoms like like and ad nauseum like before and sometimes it's during, right? So that was my question was just about like the melatonin, like is it more effective a few days before or is it during?
I would say that's like a really I think
It's fine.
it's a little bit more nuanced than that, but
Uh,
it's an interesting and maybe we'll when we go further into the presentation. I did want to talk a little bit about estrogen deficiency because even though yes we associate that more with menopause, it can be a factor for women of the menstrual years. So typically it's kind of like almost like the opposite kind of feelings that we would have. So typically like low energy, hot flashes, heat. So I have seen this in my practice with, so again, if we remember like back on the menstrual cycle, how like we do have that drop in hormones leading up to our period. So women who are tending more towards lower estrogen are going to feel that a lot stronger when it comes to like towards the end of the cycle. So with potentially a lot excess heat at night. And so like some of the main reasons that there can be low estrogen, typically it's usually like in the menstrual years is either like over exercising, being underweight, malnourished. The thyroid, which I am going to get more into, has a big role to play when it comes to estrogen. And then the other thing is actually birth control pills. And it, because of depending on the type of birth control you're on, actually can reduce estrogen, which may or for some people it could be a benefit. For some people it could also be not a benefit. Oh, breastfeeding for sure. Yes, sorry. Thank you. That's a good one too. Yes, breastfeeding, absolutely. And actually, it's the drop in estrogen that leads to many women abandoning breastfeeding because of the hot flashes and also very bad vaginal dryness and also like the worsening of any kind of like vaginal issue. The other, I need to like go to the next one because I could just start like talking about estrogen the whole time. Okay, so the next is progesterone, and so the main function of progesterone is really supporting the lining. So we build up the to basically support the pregnancy. It does have some similar roles as estrogen as far as like helping with bone health, helping with cardiovascular function. Progesterone has a kind of like a different energy than estrogen. It's much more like calming, relaxing. This is why when people take progesterone for different reasons, they often prescribe it at night because it can be, it has a kind of a sedative. So as I said, like how like estrogen and melatonin have like this antagonistic relationship, meaning like they're at opposite, like they combat each other, I guess you would say. Progesterone has like more of like an increasing. So again, so that's sort of like how that works. Sort of more like the signs of progesterone dominance or excess. So it's kind of a little bit of the opposite of what we experience with estrogen. So low moods. This is, has anyone heard of PMDD? Okay, so PMDD is more of an extreme form of PMS, very much related to progesterone and its role with premenstrual dystrophic disorder. So it's just a very extreme form of PMS where women might even feel suicidal, and it's very much linked to progesterone. Probably the number one reason why somebody would have progesterone dominance is actually medication. So whether depending on the type of birth control pill you are on, or hormonal IUDs. So hormonal IUDs are just progesterone only. I have found, again, sometimes it can be a game changer to have it, but I've also seen big benefit for some of my female patients eliminating the progesterone, the hormonal IUD, and then also progesterone is often prescribed for various reasons. And then, but more often I see more the opposite, which would be progesterone deficiency or insufficiency. And so with that, you're going to have a harder time getting pregnant. I don't know if anyone's heard of like a luteal phase defect or understands that. So it's basically when our bodies just don't produce enough progesterone after ovulation. So it makes it more difficult to maintain a pregnancy. Some ways that you might know that you might have that's when you typically would see spotting, or an unusually short luteal phase, which again doesn't typically happen, and also just like repeated miscarriage. And so some of the reasons that could happen. So probably like the number one reason is usually polycystic ovarian syndrome, which has a big effect on ovulation. So the other, I said like maybe even beyond that would be just not ovulating in general is going to be reducing progesterone, because we really don't have a lot of progesterone at the first part of the cycle because we don't really need it. So if you're not ovulating regularly, progesterone also is really important for hair. And I will see that sometimes in my practice of women who are struggling with hair loss. It actually can be due to progesterone, and we really just need to get them.
Too much progesterone, or is that testosterone?
We're gonna get that. We're gonna talk about that one. Yes, you're on the ball. So besides not ovulating, another reason that some patients might have like low progesterone is actually stress. So one of the interesting things is that we actually, I mean, I'll talk about, should I scrap it? We actually do use progesterone to produce a stress hormone called cortisol. So there's this so that if we are excessively stressed, we could be reducing our progesterone.
Oh, wow, because it modifies the
right. It's kind of like that's honestly that one picture. Like I can geek out on that picture all the time. I could just like stare at it all day. And
Can you again explain that relationship?
So basically, so cortisol is produced from progesterone. So if you're chronically stressed, you're basically converting over your progesterone to cortisol. And so you're actually indirectly reducing your progesterone.
And increasing the unhealthy cortisol.
Right. I mean, cortisol does have its merits.
Yes, we discussed
but yeah. Okay, so let's talk about testosterone. So to your point, so testosterone is pretty much like a male hormone, but we do need it even as women. So as I said before in the first slide, that testosterone does get converted over to estrogen. So that's one primary role. It also does support egg quality. It supports sexual function, really helps with libido, vaginal dryness. And so it does play a role, but we often think about testosterone when we think of testosterone excess, and that's associated with acne and facial hair and hair loss. And often it's more associated like with those types of manifestations, a specific type of testosterone, which is the dihydrotestosterone. And this is like I was going to say, it's like testosterone and steroids, but these are steroids, but like very strong testosterone. And often, classically, we would see elevated testosterone in women who have polycystic ovarian syndrome, or actually any type of like insulin resistance, because this is all going to be increasing testosterone. Also, which I'll be getting to that in the next slide. So stress can also be a big producer of testosterone, because in the next slide, I'm going to be discussing a hormone that's produced during stress that actually also feeds the testosterone. But then there can be problems also with too low testosterone. We see fertility challenges. We see sexual function challenges with low testosterone. This again is much more like when we like in this age group, we see it much more associated with low like very like deficient, not enough caloric intake, excessive exercise, but also in birth control pills. And the reason is, so birth control varies greatly by the synthetic progesterone, which are progestins, and they have like different functions. And so many women who choose to go on birth control, yes, it might be to prevent pregnancy, but often it's because they want like clear skin. I don't know if anyone here decided that they wanted to go on birth control for clear skin. Well, the reason that that type of birth control clears your skin is that actually it tanks your testosterone. So you have the benefit of clear skin, but then you have some of like the downsides of too low testosterone. Sure, absolutely. So we always, so first of all, we always, I guess like a little bit about testosterone, and maybe I'll get that more in testing. The levels of testosterone don't vary too much throughout the cycle, but we see the biggest recruitment, and mostly because a lot of it gets converted over to estrogen, which actually that's something also I forgot to state when I talked about this cycle was, so in normal functioning bodies, with female bodies, because the testosterone is never too high, it can be readily converted over to estrogen. But if you have too much testosterone, and one of the other issues is it sends different signals to the body to actually not convert it over too much, which is kind of annoying because you want to have that estrogen. But basically, it's at the beginning when the body senses that there's too low of the estrogen and progesterone at the beginning of the cycle, the pituitary gland secretes luteinizing hormone to basically tell the ovaries, hey, we need some testosterone because we want to make some estrogen. I think I... Oh, yeah. I guess I'm like nervous. Like, I don't know. I'm like afraid it's going to fall.
There. You should be safe.
Okay.
You can use your hands.
Okay. I don't even have to touch it. Okay. So this is the hormone I was alluding to earlier. So this is DHEA, and it's one of our big parent hormones. I put it in this group, even though it's actually technically not really produced in the ovaries. It's really produced in our adrenal glands. I'm going to talk a little bit more about the adrenal glands. But it's so DHEA, besides being a precursor for, you can say like it gets converted over, it becomes testosterone, and testosterone becomes estrogen. So we say estradiol. So basically, there's 3 different types of estrogen. I didn't really get into that. But anyway, so DHEA also has its own hormone properties on its own, and it is more on like the male side of hormone properties. So this is where, when I was talking about excess testosterone and stress, this is really what I was talking about, is the DHEA. So often I'll have a patient who is obviously has like characteristics of excess testosterone. I always want to run her DHEA to see if that's the area I want to be focusing my attention when it comes to treatment plan. So one of the other things with DHA specifically when it comes, so there's a specific type of polycystic ovarian syndrome, which is much more associated with the adrenal glands. And in these women, when they experience like the normal stresses that we have, their adrenal glands, for whatever reason, I think it's probably genetic, is that their bodies just pump out much more DHEA than women that do not have PCOS. And that leads to things again like acne and hair loss, fertility challenges. So DHEA is also very important for fertility as far as like egg quality. It also, again, besides the fact that it is a precursor to all these hormones, it also supports a lot of our sexual function. That's why on the flip side, you also don't want to have too little. So too little DHEA can present with fertility challenges, but also is actually associated with some autoimmune conditions. So we definitely have found that in some of these patients actually are benefited by having DHEA. So there's like both sides. So I'm just going to talk about like so again, there's a lot of hormones, and I know that mostly everyone here is more interested in the reproductive hormones, but I did want to talk about 2 other types of hormones that yes.
Besides for DHEA, the rest of the hormones you spoke about are produced in the ovaries?
Yes, exactly. Well, yes and no. Okay, so we actually do produce, believe it or not, our fat tissue, also called adipose, is actually technically a gland, and we do actually produce all these hormones there as well. And specifically, we convert over like testosterone and everything in our fat tissue. So not just in our ovaries. We also do back to like the estrogen thing. So typically when I'm talking about like the menstrual cycle, I'm focusing on estradiol, which is the estrogen of menstruation. But we actually have 2 other types of estrogen. So the other one is estrone. Estrone is the estrogen of menopause. I mean, we all have it, but that's like that's the estrogen that really remains after our menopause. That's produced primarily in the adrenal glands. And the last one is estriol, which is primarily produced in the placenta. So there's actually technically three types of estrogen. So so I always find it's really important again to talk about the HPA axis hormones when it comes to just when talking about hormones, but specifically talking about hormones of reproduction. So I think some of you might have been here for my stress talk, but I will just kind of do like another recap. So when we're talking about so we have the HPA axis, which is the hypothalamic pituitary adrenal axis, which is basically what happens when we are stressed out, like our signal of like, flight or fight. Now, we also at the same time, as like I think you might have heard me say, like LH and FSH all come from the pituitary gland. So we also at the same time have an HPG axis. So that's the hypothalamic pituitary. We say gonadal because men actually have this as well. It just doesn't talk to ovaries. It talks to something else, and it's a whole other presentation. But basically, why this is important is that if we're stressed out, more attention gets drawn to the HPA axis and less gets drawn to the HPG axis. And remember that those 2 pituitary hormones, LH and FSH, are really important for our cycle to function. So if we're really stressed out, this is going to be the predominant axis. And in fact, actually, it's CRH, which basically comes from the pituitary and tells the adrenals to like, hey, we need cortisol, actually tells LH and FSH to go away. It says like, we don't need you right now. We're stressed out. You don't need to have a baby. We're just going to pump you full of cortisol. And cortisol is going to be increasing blood sugar. It's going to be increasing blood pressure. And at the same time, again, it is going to be basically suppressing your hormones. I mean, your other hormones. And as also I mentioned in previous slide, is that cortisol also is produced from progesterone. So that's also going to be reducing progesterone. And then the other big thing, back to like the previous slide about DHEA, is that you're going to be having much more DHEA, and that's also going to be causing things like potentially like acne and hair loss.
What was the previous slide?
So this is DHEA.
That one. That one's a cute little picture.
Oh, it's just there for filler. It's a transition slide. I don't know, yeah,
Basically, what we're saying is that when we're stressed, our body goes into fight or flight, meaning if you need to run away from a burning house,
Right.
then you're not in a position and your body turns all of its energy to survival as opposed to let's
reproduct, right, right. Yeah, I mean, basically, yeah, it's just like, even like to the example of like, if your house is burning, you just take a few things. You're not being like, you're not looking around, you're not thinking all these other things, like, because we technically don't need, like, our single body doesn't necessarily need to reproduce. I mean, we do need to reproduce potential, like, you know, as a species, but like for our body to survive, it doesn't need to, it just needs like the bare minimum. And so when it's in that mode, it just shuts off anything extraneous, because also reproduction is, it's a big energy sink. I mean, anybody, I mean, has anyone, I've been pregnant, I know you've been pregnant, it's a big thing. Even after you've had them and you're like, you're breastfeeding, you're burning a lot of energy right there. So if you're stressed, it's not going to be working very well.
So therefore, when we have high levels of stress, we're basically telling the body, right now, reproduction is not the most important, let's not send our troops over there.
Right.
So in order to improve, we would think, improve reproduction, we would proactively work on reducing that stress.
Oh,
so our body
100%.
can focus in on that.
Absolutely. And like, and when we talk about stress, we're not just even talking about like, you know, the mental, emotional stress, but like any kind of like, if like you've had surgery, if you've gone through something like physically traumatic, famine, like any, like, because even like, as I mentioned before, how much like our caloric intake is important for our hormones to function, but they're also, because it also causes stress in the body. Yes, yes. So I want to talk about the thyroid, and the reason is our thyroid gland and our thyroid hormones are actually like some of the most important hormones. In fact, pretty much every single part of our body has receptors for thyroid hormone. We associate it mostly with metabolism, which basically is just how we utilize the food in our body to breaking it down, utilizing it in other places. So that's like the big thing. But thyroid is actually really important for our hormones like estrogen and progesterone. In fact, actually, they can be greatly thrown off or reduced if our thyroid is not acting appropriately. Our thyroid gland is in our neck. The other things that we think about with thyroid, like you know, heat regulation, our hair, our nails, really so many different parts of our bodies really depend on thyroid functioning normally, our digestion, etc. So when we think about thyroid hormones, we really think about 3 specific hormones. And I like to kind of give us an example of like different types of bank accounts. So we first have T3. And so T3 is our most active thyroid hormone. And I like to think of it like as like our checking account, like our debit card. Like you can just like use it. Like you can just like quickly use that money, get yourself a cup of coffee. T4, on the other hand, is less active and needs to actually be converted over to T3 in order to have a function. So I like to think of that more as like a savings account. We have that money there, we have that potential, but we can't just like take it out and like buy that coffee. Then it's not on here, but the other thyroid hormone, it's like the anti-thyroid hormone, and that is reverse T3. So reverse T3 actually has no activity. So I like to think about that like you went to buy like that, like, or even worse, not worse than that, but no, like you go to buy like $1,000 like ticket, like a plane ticket. You go online, you're so excited, like this is a good price, whatever, and then decline. Your bank has put the kibosh on it because they think it's fraud. So that's what I think of with reverse T3. And basically all these thyroid hormones get secreted based on another pituitary hormone I love pituitary, which is thyroid stimulating hormone. And if there's not enough thyroid hormone circulating, you're going to have TSH saying, hey, we need more. So more TSH gets produced. And then on the other side, if there's too much thyroid hormone or there's sufficient, that goes down. Now, we mostly think of thyroid or like thyroid imbalances when it comes to hypothyroidism. I would probably guess at least one person in this room knows at least one person with hypothyroidism, but I could be wrong. Yeah. It's usually 9 times out of 10, if somebody says they have a thyroid issue, it's usually hypothyroidism. So characteristics of
you know if you have a thyroid issue?
I'm going to talk about that. Okay, it's fine. So typically, somebody with hypothyroidism might have difficulty losing weight, or they've had like maybe even dramatic weight gain, hair loss, also like thinning eyebrows, dry skin, cold intolerances, sleep issues, depression. Actually, many people with depression actually really have hypothyroidism, and they've been misdiagnosed, which is kind of crazy. Irregular periods, whether super heavy, infrequent, too frequent, actually can really just throw your period off all over the place. Fertility issues. So more and more specifically, fertility clinics are really recognizing the importance of thyroid function, and they do actually test for thyroid. So those are some of the symptoms. Now, what's interesting about the causes of thyroid or hypothyroidism. So probably the number one cause of hypothyroidism is a condition called Hashimoto's, which is an autoimmune condition that basically attacks certain components. Basically, it doesn't directly attack the thyroid hormone. It basically attacks certain other components that are involved in the production of thyroid hormone. So that's typically the number one reason. And so the way we would know somebody has Hashimoto's, besides they come in the symptoms, we do the blood work and they test positive for these auto antibodies. Now, another reason why somebody would have hypothyroidism is actually it could be a conversion issue. So as I said before, T3 is more active, T4 is not so active. So we really do need the T4 to be converted. So what are some of the causes of that? First off, different nutrient deficiencies, zinc, iron, iodine, B12, tyrosine. These are all really important for that conversion. Stress, cortisol actually blocks that conversion from T4 to T3. Certain medications can have an impact on the conversion. Then the other is, as I said before, too much reverse T3. So you might even be like, why do we have reverse T3? What is up with that? What is this even serving? Well, this actually does help. Again, if we think about survival, when we need to basically hunker down on resources, and we need to our body actually needs to slow down metabolism because there's not enough resources. So if our body thinks that it's in starvation, it's going to be increasing reverse T3. So like anybody who's like done a crash diet, or even this is one of the reasons why some diets, people will be like, I plateaued, but often it's because your body thinks it's starving and is producing reverse T3 because it doesn't want you to be losing too much weight. The other thing that can also cause an increase in reverse T3 is inactivity, so not moving your body enough. And then the last reason why you might have hypothyroidism is actually your tissues. So as I said before, is that like we have all these like receptors for thyroid hormone, like on like every part of our body, for some reasons, our tissues are actually not responding. So one of the ways that we actually even test that. So the weird thing is that these patients actually have like normal labs when it comes to thyroid. But if we do something like a basal body temperature, we'll see that they're running very low. We know that they're having difficulty there. And typically the biggest reason for that is usually inflammation. And so by working through inflammation and also exercise, those tend to be the primary reasons. I'm not going to talk too much about excess thyroid hormone. Not that it doesn't happen. I do see it in my practice. It's a condition called Graves' disease. It also, the other thing I forgot to mention is that pregnancy also has a big impact on thyroid hormone. So we often will see some patients will develop hypothyroidism as a result of pregnancy. Sometimes it's often temporary, but you can also actually see some patients develop hyperthyroidism as a result of pregnancy as well. And basically those symptoms are like the exact opposite. So dramatic weight loss, diarrhea, heart like pounding on your chest, really hot. But that's a whole other condition. Okay, so how do we know if my hormones are out of balance? You know, you probably, everybody's now super confused already. And specifically why it can be confusing is like, I don't know if anyone's noticed, but some of like the imbalances I discussed for certain hormones like overlap with other hormones. And so it's like, how do I know? Is it my thyroid? Is it my estrogen? How would I even know this? So you might have a group of symptoms, but we have to dig a little bit deeper. We can't just go on symptoms really alone. And that's where testing, I think, is really, really important. There's like basically like three main ways. There might be more, but these are the three that I would commonly use. So first would be like looking at blood tests. Why I wrote day 3 and day 20 is a couple of reasons. So what do I even mean by this? So day 3 is like the 3rd day of your period. And this is like a classic time to do hormonal testing. I'm going to talk about that. Okay, sorry.
Doing great.
Okay. So why day 3? So one of the main reasons that we like to do day 3 is because we're actually concerned with what FSH is on day 3, because FSH, follicle stimulating hormone, is an indirect marker for ovarian reserve or egg quality. So basically egg quality and egg count. So that's one of the reasons why we would do day 3. Also, there are certain levels. So yes, progesterone day 3 is kind of bogus. You're not really going to get any information there. But estrogen, those levels day 3 also, they can be significant. We don't want them to be too low. So this could also be like, if I have a patient has not been getting her period, and I would definitely want to be doing a day 3. Well, I mean, there's no day 3. There's no cycle. Right. So because I don't think that I know, like, is she not getting her period because she doesn't have enough estrogen? Is that the issue? Like too low of estrogen? Like, is it like around like a 15? Like definitely not. Like you definitely need to be having a steady, like a baseline of at least like 25 in order to have a cycle. You know, someone who has PCOS is also not having a cycle, but her estrogen might be something more like a 40 or a 50. The other thing too, why you would want to do a day 3 estrogen is if we are thinking about things like IVF, for example, because it can like tell you if you're going to be a poor responder. So it is actually, there is some merit for doing the day 3. But to your point, day 20, and I put day 20 in quotes because if we remember, the follicular phase can like vary tremendously. Why we say day 20 is that like if you were like a classic like 28-day cycle, day 20 is typically where you would see progesterone at your highest. You know, when I'm working with patients, I'll usually have them, if I'm curious about luteal phase, I'll have them track their ovulation and plan to do a blood draw about 7 days after ovulation, because that would be technically where you would see the peak progesterone. Peak progesterone is important specifically if we're thinking of like, if we're trying to figure out why a woman either might not be getting pregnant or she might be having miscarriages, and we want to kind of see what that is. So here's all the hormones that we would be looking at. So we've talked about FSH and LH, DHEAS, again, really important specifically for PCOS patients or anytime where there's definitely symptoms of excess male hormone. But I want to see, is it because they're stressed out or there's an unusual stress reaction? I talked about estradiol, progesterone. I didn't talk about sex hormone binding globulin. So sex hormone binding globulin, it's not really a hormone, but it is important to test, mostly because that's going to help facilitate the conversion of the testosterone to the estrogen and can be very low in women with PCOS. Also, excess can also be problematic. We talked about dihydrotestosterone, which is like the really strong testosterone, and then prolactin. So I didn't really get into that so much, but it can be significant, again, if there is menstrual irregularities, acne. It's not necessarily a hormone that we associate with the menstrual cycle. It is a hormone we associate with lactation. It's produced by the pituitary tumor. It usually is a pituitary tumor if it's way in excess, but anyway, it's produced from the pituitary gland, and it is important just to like look at that. Something interesting, I have actually seen it elevated in women when there's excessive drinking, and just by like cutting out drinking, like makes it go down to normal, which again is kind of interesting. Thyroids.
I'm just so glad that Hashem runs the world. Because if I had to balance all these, my brain would be mush.
Right.
Like, thank you, Hashem, that you do all this without me even knowing.
Yeah, exactly.
Obviously, this cocktail of hormones is a female cocktail. Is the whole hormone situation more complex in females than in males?
That's a good question. So both females and males have all the same hormones, but we have them in different amounts. You know what? I'm not a urologist. I do have some male patients, but because I really work mostly with women, I really couldn't. I mean, I think it depends, really. I mean, there's probably some male hormonal. You're like, I mean, I think ours is more important. I don't know. That is. Thanks for that question.
Fair.
So I also like to do like a full like thyroid, because again, like thyroid is so, again, because we saw like there's like a overlap in symptoms, and also how the thyroid can be dictating how everything else in that first group is going. So TSH, which is thyroid
These
stimulation.
all tests you ask the lab for?
Yeah, exactly. So free versus total. So free is like what's readily circulating, because some of the thyroid hormone is bound. That's like not so significant. Again, I want to see reverse T3, because again, want to see like if it is hypothyroidism, like why, and like what are the factors. These are the two autoantibodies I was talking about with Hashimoto's, and then like some nutrients are really important. So iron panel, B12, folate. I didn't put it on here, but MTHFR, which is basically looking for if you have like a mutation where you're not really activating folate. Vitamin D is also very significant. And then anything like blood sugar related, so insulin and hemoglobin A1C are really important. Again, like if we're thinking about like why is testosterone high, why are there menstrual irregularities. I'm actually working with a woman right now who has very high insulin, and because of that, she has really bad what we call intermittent, like spotting, basically. Luckily for her case, like she wouldn't qualify for halakhic infertility, because it actually happens to be during the luteal phase, so it wouldn't really affect like her getting pregnant. But so we want to like fix that up, and the big driver for her is the insulin. So cycle mapping.
Before you go there, can I ask
Sure.
a question?
Yeah, of course.
So it sounds like you'll only get certain information that you want from day 3 and other information from day 20, because certain things, like you said, like estrogen is going to be high when?
Right. So estrogen basically is going to have like a peak right before ovulation, but then it still is relatively on the higher side at the second half of the cycle.
Okay.
So you're basically going to, I mean, the typical like classic cycle, like you're really not going to see much like estrogen, progesterone activity until like around like day 10. Like you're going to see like the estrogen's like going to be like picking up, and then it'll like drip down a little bit right after ovulation, and then it kind of like sort of a steady state.
So meaning by day 20, both estrogen and progesterone are higher.
If you've ovulated, because
You get your period without ovulating?
So Yes, actually you can. Yes, you can. You can 100% can. That's how birth control pills work. But like even without birth, so yes, you can. But also, some women at day 20 still haven't ovulated yet. So
Right, no, I'm
again,
just talking
yeah.
in terms, like I'm saying, like, you're saying these blood tests, like if someone's thinking that they have low estrogen or high
Right.
estrogen, which get like. How, like, which day would be better to test that? That's my
Oh, so
question.
that's where almost we get it to your, we get even to a better case to answer your question like that, because again, like it's just like one instant in time, and like knowing where you are in the cycle, and like that's why like whenever I'm working with patients, like getting as much information, but this would be more of the testing where you'd be interested. So this is what we call cycle mapping. And cycle mapping can be done either with saliva or urine. And instead of just doing like one point in time, we're doing multiple days. So you basically test pretty much every single day of your cycle. There's different test kits. And that's really where you're going to be really seeing how estrogen and progesterone are playing out in your cycle. And like you can be...
How does it work?
Sure, absolutely. So whether you're doing saliva, whether you're doing urine, you ideally want to be doing the same part of the day every day. So because actually even through the day, the levels change. And that actually is with all our hormones. Not even so even like whenever I have like a patient, I need to know like when did you test? So ideally you want to be doing it around the same time every day. And again, it's either saliva or urine. I know definitely with saliva, like there's like certain there's like just I think there's certain things that can react with the reagents. So I think you're like you have to do it like before you brush your teeth, or like so there are some things that can.
So how does it work? Like you get a test kit and then you do it at home, like,
Yeah, exactly.
and then you can see the results,
wow.
or you have to send them in?
So you basically you do all your testing, and then you send it in, and then they come up and let's kind of go. You like see this little map.
So you would like do, let's say, a sample of saliva every single day at 9 a.m., let's say, I'm just giving an example.
Yeah.
Or urine every single day at this time, and then you send in all those samples to the lab,
Right.
and then.
Yeah,
then you-
exactly. Yes, yes.
Oh, wow. Exactly, the more accurate. I guess math of your.
Right,
versus
exactly.
the
'Cause
blood test.
yeah, because also I don't think I mean I've never heard of anyone taking blood every single day.
So that's what I'm saying, like if
yeah.
someone wants like. Are you getting in the cycle mapping? I don't know that you're getting all the information of all like iron and vitamin D. Are you?
No, you're not getting that. No, you're just looking at estrogen and progesterone.
Just estrogen and progesterone.
Yeah.
Probably could benefit also from the blood work.
Right. So like often like when I'm working with patients, we're doing like a bunch of different types of testing. Again, it also depends on like other factors and like what they're seeing me for. And that's where I also like so the last test that I'll often order, it's called the Dutch test complete. And so what's interesting about this test, so it's done during the luteal phase. So definitely always, unless like I mean, there's sometimes we don't do it during the luteal phase. What is interesting about this one is that we're not just looking at hormonal levels, we're also looking at how our body metabolizes hormones. And that's actually going to get, like when I get more into like the hormonal balance part, it'll be more significant. Because that's also going to play out. So it's not always just even about like, oh, estrogen dominance. It's more about like, how does my body like metabolize estrogen? And okay, if I know how my body metabolizes estrogen, is it going down the correct path, or is it going down a path that's not so beneficial? And if it's not going down that not so beneficial path, what can I be doing to bring it to the other path? So that's one of the reasons why the Dutch test can be useful. The other thing it also looks at is it does look at cortisol. I didn't talk so much about how cortisol actually, we have like our own like cortisol rhythm. And so what it does look at is like, are we excreting cortisol high at certain times of the day when it should be high, or are we not? And is that a factor? Is it overall too much cortisol production, or is it because even too low actually can be problematic as well? So we're also looking at adrenal function. It also looks at various neurotransmitters, things like dopamine, serotonin, norepinephrine, and epinephrine, various markers of oxidative stress. So it's a very useful test. And I have like specifically sometimes like you do one of these conventional blood tests and you don't always get any answers. And that's like, oh yeah, what do we do? But what I like about the Dutch test is it usually always finds something. I've rarely found that it hasn't like shown me some information that was really helpful in the case.
How is it administered? Is it blood? Is it?
Sorry, this is urine, actually. Yeah, it's a urine test. And because you're doing the cortisol, you do urine a few times during the day because you're basically like mapping the cortisol.
So it's also similar to the cycle mapping that you're administering the test yourself.
Yes, exactly.
Sending the
Yes,
sample.
yes. And Dutch also does, so like how I said that there's a urine, they do a urine cycle map. So it's the same company. Okay, so we're going to get to the fundamentals of hormonal health. And so the hard thing is that so it says balanced nutrition. I like to say balanced nutrition versus diet. So I'd say first off, definitely when it comes to hormonal balance, specifically in women of the menstrual years, it's rarely appropriate to do extreme like intermittent fasting or fasting. Obviously, we fast like Yom Kippur, minor fast days. Sometimes we might have to fast like because we need blood tests or something like that. But I would say in general, it's rarely appropriate because of how it can have a negative impact on hormones. And because I think you might have heard me a couple of times saying about like how like not having enough food and everything can have an basically suppress some of our hormones. Similarly, not appropriate to majorly reduce any specific macronutrients. So reduction in carbohydrate, fat, or protein. We all have our own individual dietary needs, but I rarely find that is appropriate. So that's kind of like the big thing. Now, when we're talking about balanced nutrition, what I'm talking about is like one, our bodies really like us to be boring, to work well. So it means giving our bodies predictable, balanced nutrition throughout the day. What am I talking about is one, definitely want to make sure that we're getting enough protein at each meal. Protein is really important for the building blocks of hormones, blood sugar balance, complex carbohydrates. What am I talking about? Complex carbohydrates are carbohydrates like grains and starchy vegetables that have at least 2 grams of fiber per serving. It's really important for blood sugar balance. Enough fruits and vegetables, specifically vegetables. I'll get into this more in that next slide, but many of our vegetables, specifically our cruciferous vegetables, are really important for the metabolism of hormones. So we want to make sure that we're getting enough of those. Things like broccoli, cauliflower, cruciferous or brassica vegetables, cabbage.
You said so proteins are good for the building blocks of hormone. Complex carbohydrates are looking for
Blood sugar balance, also gut health. And then I'd also say like healthy fats, things like avocado, olive oil, really important when it comes to like balanced nutrition. Timing of meals. So what am I talking about? So most of us benefit from regular meals spaced anywhere from like 3 to 5 hours. Again, like predictable. Obviously, life happens, but like the more predictability we can have, the other, like I know that I had said like no fasting. There is like this like what we call like an eating window. So ideally we want to be like eating between 8 a.m. and 8 p.m. And the reason actually is the more that we eat outside that window, we actually cause our pancreas to excrete more insulin than it would like. And that's just like setting yourself up for insulin resistance. It doesn't mean if it happens like once in a while that you're like destroying your body. But if you're repeatedly doing that, you're not doing your body a favor. I'd say similarly, excess sugar, excess refined carbohydrate. Also, again, it's okay to have it like sometimes, but excessive amount is not going to be doing your hormones any favors. So now I'm going to talk, so I actually probably could do like a whole presentation on this, but it is really important when it comes to hormonal balance. And first of all, when we think about like toxins, what we're really thinking about is toxic load. And that's basically the amount of toxins that our body comes in contact with versus how much like our body is able to excrete it through our various routes of elimination, things like our liver, our kidneys, our skin is actually one of our organs of elimination, our lungs, and our digestive tract. And why it's so important for hormonal balance is, first off, many toxins are what we call endocrine disruptors. So endocrine disruptors actually either mimic some of our hormones. We sometimes will call them xenoestrogen. They often come in plastics, many of our cleaners. They have like estrogen-like properties, or they block certain receptors. So again, thinking about hormones and receptors, so they actually will block some of the receptors that and they kind of like confuse the body. So that's one of the reasons why toxins are really it's important to like discuss it. But also, again, when we talked about like the Dutch test and we were thinking about like the metabolism of our hormones. So if our bodies are metabolizing all these toxins, you're kind of like overrunning that sink. Like if you're trying to like throw cholent down the sink, you're throwing all these things down, like how is it going to be also at the same time detoxifying our hormones? So that's one of the reasons why it's so really important. And you know, some of the main like sources of toxins, unfortunately, plastics are like so ubiquitous, and specifically, you know, the toxins in plastics are, you know, huge on like the endocrine disruptor list. A lot of our household cleaners, our personal care products, our foods, unfortunately, whether it's, you know, from, you know, pesticides or hormones, but also a lot of the additives. And some of these additives, which is kind of scary, they don't even put them on the labels, which is really terrifying. So our bodies are constantly coming in with these various toxins. I actually have a whole guidebook for toxins and detoxification. I'm happy to send it to anyone who is interested. And whenever I'm like thinking about detoxification, like the first is like always, as much as possible, like doing like purge and swap. So really trying to like minimize the amount of harmful materials we come in contact with. There is a really good website. It's called the Environmental Working Group. They have a couple different search engines. You can like look up all your products. You can like find better products. So the first like step would be just like really just like as much as possible. I mean, obviously, like you know, it's hard. Let's just say it's really hard to like get rid of all these materials, but we can definitely, you know, do the best we can. And then the other is really optimizing all of our routes of elimination. So our breathing, dry brushing, like our skin, liver support, whether it's through castor oil packs, whether it's milk thistle, which is milk thistle right here. There's definitely different nutrients, also nutrients to support the kidneys. So when we even think about how toxins are detoxified, mostly they enter through the liver. The liver converts all these like fat soluble toxins into water soluble, which either get excreted through our kidneys or excreted through our bowels. Primarily actually our bowels. And that's one of the reasons, like if I'm like working with a patient and I want to do any kind of detoxifying protocol, I need to make sure that their bowels are moving. What I mean talking about, I mean regularly having a BM, a poop. If you are constipated, you have to get your bowels like on track before even like doing any of these, because what's going to happen is the toxins are just going to keep on recycling back. So your efforts are going to be a waste. Stress management. So as we mentioned before, how cortisol can affect progesterone, and also like stress can like increase DHA. Definitely stress management is really important. It doesn't have to be meditation. It can be, you know, taking a walk. It can be like chatting with your best friend. It can be doing like psychotherapy, cognitive behavioral therapy, journaling, painting, drawing, leisure, dancing. That's actually my favorite stress reliever. I dance 3 to 4 days a week because it helps me. So it really can be, it can even be just like reframing. Anybody who was here when I gave the talk a few months ago, I talked about structured, scheduled worry time. And this is the concept of actually giving yourself permission to worry about something, but because you do it in a predictable, structured way time, that as the day progresses and like the thoughts are like, no, I'll do that tomorrow. I'll do that tomorrow at 12 o'clock. That's when I stress out. Yeah. Okay. So exercise. So as I mentioned before, how it's really important for like thyroid function. So exercise is like one of these like tricky ones. So yes, it helps with stress, and yes, it helps with thyroid, and it helps with metabolism and all these things. I'd say really, when it comes to exercise, timing and quantity are like really the key, and the type of exercise. So because we pretty much are more in high cortisol at the beginning of the day, and actually a lot of aerobic exercise is actually a cortisol inducing activity. It's better if you're going to do any kind of like high intensity exercise at the beginning of the day when cortisol levels are high. And then on the flip side, like if you're doing like more restorative exercise, more relaxation, stretching, like that's definitely geared towards the night. Now, excess exercise can definitely disrupt the menstrual cycle. I have seen this very often in my practice, women not getting their periods because they're just doing too much exercise. So if you're exercising a lot and you're feeling tired, you're not getting your period, maybe you're also like noticing like some like hair loss, it's probably time to like step back. We all definitely, so I would say definitely it varies from person to person, because also the other thing, if you are like an athlete, like maybe you're training for something, as much as like you're actually engaging in the exercise, it's also important to take rest, and also making sure that your body is getting enough nutrition support, specifically as women. We just don't deal as well. Like our body is like, we have a lot more going on than men. So we really cannot, specifically if we're trying to get pregnant, we want to have like a regular cycle. We have to really be taking care of our bodies. It is important to move. I mean, movement again is really important for stress. It's important for mood. It's important for our digestion, but we want to, kind of touch in. So yeah, like I would say, I would say it's like fairly intuitive that you might be getting too much exercise. Like if also your sleep is suffering, there's a lot of things that could be suffering if you're having too much movement. Also like aches and pains. Sure.
Exercises according to like where you are in your cycle, like cycle syncing.
Oh yes.
Is that also like something that's like really important, or is it like just something if you wanna like?
Again, like it can be, so I feel like also everybody's a little bit different. So for some women, it definitely, I have noticed, it does make a big difference. I mean, there's some.
Can you talk a bit about, maybe not now, or if it's part of it, like cycle syncing, like that concept?
Foods and exercise and cycle syncing, like
According to where you are
in your cycle.
Yeah, absolutely. So, I mean, a big part, like, again, so one is the follicular phase, again, being like this very, it's like a little bit tricky, because again, like I feel like everybody's so different. I mean, definitely when it comes like to the food part, definitely like at the second half of our cycle, because like we want to make sure that iron is high. So that's like when we really want to be focusing on a lot of our iron-rich foods.
So yeah, can we label it?
Oh, sorry. So so ovulation happens, and then it's like the second half of the luteal phase.
Like and like when 2 weeks before your period.
Yeah, so that's like where you want to put the focus on more like iron-rich foods. So things like meat, but also beets, a lot of like our leafy greens. Goji berries are actually really high in iron, so we want to kind of like have like a focus on iron-rich foods. I'd also say like, you know, the week before, again, everybody is a little bit different, but like, you know, also calcium is also, so like the primary things like iron, calcium, magnesium, specifically for cramping.
Yeah, like, meaning, okay, like, for example, like, these are all good throughout everything.
Right.
But if someone notices they might be deficient in one of these, should they take a supplement during their 2 weeks before their period?
Yes, it's often, yeah. So like sometimes I'll have women just take iron at the second half and not throughout the cycle. But then I have someone I will recommend throughout because they're very deficient.
Okay. So you mentioned iron, calcium, magnesium. These are all things that you would say need an increase in the second half, the luteal phase, as you said.
Right.
Okay.
And also like the other thing, so a couple of things too about like any kind of change that you're making as far as like for a cycle, you really have to like implement it for a few cycles to really notice a big impact. It usually takes about like 2 to 3 months to notice a big difference.
Question about magnesium.
Sure.
I one time took magnesium and like I vomited right after, but I was feeling completely fine before that. I'm wondering if like magnesium could have that some sort of like side effects, or is it just.
It's funny, I've never, so to the magnesium point. So first of all, there's a lot of different forms of magnesium. Typically, usually I'll have patients that if they have too much magnesium, they might have like diarrhea or very loose stools. I haven't necessarily heard the vomiting one. Do you know what kind? Like if there's.
I don't know. It's not someone's house.
Right.
And I was feeling completely fine before that, but right like a few minutes after I took it, I started feeling sick and then I started vomiting nonstop.
And it was definitely magnesium.
I don't know for sure that was the cause, but.
Then like you definitely took magnesium. Okay. Yeah, no, I mean, I have heard of other supplements or other things that have like the big one, like iron and zinc tend to be like GI upset and like can cause
Did you take it on an empty stomach?
Yeah, I think so.
yeah, I don't know. And I've just never heard that. Yeah, I would love to answer that question, but yeah, I've never. It's interesting.
You said there's different magnesiums. Is there, like,
Oh, yeah.
you know which ones to pick?
Yeah, so it depends like what we're using it for. So like magnesium, like oxide and citrate. So usually I'll recommend that type of magnesium so all of them have like more or less like a calming effect, and that's why we usually will dose them at night. I usually will recommend citrate or oxide if there's also like a constipation issue. So like as I mentioned before, like how important it is to be having a bowel movement. If a patient has like normal bowel function or even is someone who might even be more towards like looser stools or like diarrhea, I usually will do glycinate for 2 reasons. One, glycinate is more the magnesium I would associate for mood actually, and sleep. And then it has, you always have like that one person who's like the weird, I don't want to say weirdo, but like I have one patient that claims that the glycinate gives her diarrhea, but like I've never, that's not supposed to happen, but for some reason it happens with her. It's more about the form than the actual method per se.
What do you mean form?
Oh, so
Oh,
like
I mean,
oxide, yeah,
citrate
yeah.
or-
And then so malate, magnesium malate is more the magnesium of muscle. So like cramps and things. So malate actually could really be good for menstrual cramps. Malate is also useful for blood pressure. Then there's like some other ones. Like there's also magnesium L-threonate. That one we dose very low. That also is good for mood and sleep. And then there's even another one. There's another one that so we also use magnesium a lot for blood sugar. And there's one, oh gosh, now I'm like, it's another T. Oh, taurate. Magnesium taurate, which you don't hear so much about, but there's some really good research with PCOS and magnesium taurate. There's a lot of magnesiums. So I think this is my last slide. This is a lot of material. Thanks for bearing with me. So gut health. So gut health is really important when it comes to hormones. So has anyone heard of the estrogen? Estrogen? ESTROBLOME. So what that is, but people are familiar with like the microbiome. Okay, microbiome. So this is actually a microbiome in our gut that actually metabolizes estrogen. And so really the diversity of species in our gut have a big impact on like how much estrogen is circulating in our body and also like in what form. So that is one reason why gut health is really important. The other reason is people are familiar with leaky gut. Okay, so leaky gut, basically what we're talking about is like an increased permeability via the tight junctions and like leaky gut. So they usually like in more like scientific or medical journals, they'll say intestinal permeability, but basically there's like a weakness. And so that increases inflammation. And remember, inflammation also impacts our hormones. So these are like some of the big reasons why gut health is so important. And then also then the other.
Explain the leaky gut in like layman terms for a second.
You want to? Sure.
I'm saying the permeation of, so basically it means that each one of these little folds is meant to be taking out toxins or taking out the good things and leaving just the garbage to exit.
Yes.
But the problem is that if there's leakiness in this membrane, then toxins are also getting through and it's mixing together with,
and also things that wouldn't even be considered toxin, they're just not supposed to be there.
it's not right.
And so it also, so that actually sends this whole cascade, like, because lining outside, you have like all these immune cells, and they're like, what is that? Let's create this crazy immune response all over the body, which can have a big impact on hormones. So some of
This can create like major autoimmune issues.
Oh yeah. And then also, as I mentioned before, if you're not regularly having a bowel movement, you're also just getting the recycling back of toxins. So like if you're not, so we want to make sure that that is happening. So if we want to first like look at the estrogen and like how do we optimize gut health, we really need to optimize the diversity of microbial species. And the number one way, I'm going to tell you. Okay. So basically we're talking about like all the different types of like lactobacillus, bacillus, all these different species, and they're really sure.
Basically in here, there's healthy bacteria.
Yes.
I know sometimes we wash our hands, we're like, oh, let me wash off bacteria, but there's good bacteria and
they're bad
bacteria.
Yes.
So what Dr. Ivy's about to tell us is about how to grow more good bacteria that's really meant to be there.
Yes, and I'm going to tell you the number one way to grow good bacteria and diverse bacteria is probably not what you think. It's about getting at least 30 different types of plants in a week. Wow. So the diversity of plant fibers actually is what really supports the growth of different bacteria. Yes, I will also recommend a probiotic or fermented foods, etc., but really want to get the diversity of plant fibers. Now, the good news is that some of us might actually be better off than we think, because chocolate is technically a plant fiber, as is coffee and tea.
30 different kinds of chocolate.
Well,
Also, like
to keep an eye on your insulin once
right,
the sugar
yes.
hits, and then it messes everything else up because the sugar actually kills good bacteria.
Right, exactly. But like the other thing is like diversity. Like if we even think about like, yes, these are technically all tomatoes, but they're all technically different tomatoes. You have red tomatoes, you got orange tomatoes, you got
count different kinds.
Yes.
Basically also just eating a variety of foods and not just sticking to like a few same foods and eating the same meals probably is good for you.
Exactly. So one, we want to increase like the diversity of beneficial bacteria. The next is like eliminating, again, like back to like how I was talking about, detoxification and everything, like eliminating things that are going to be harmful to the gut. So like some of the big ones actually are medications. So like NSAIDs, which are like our ibuprofen, Tylenol, etc. Excessive use. Obviously, sometimes we have a headache, sometimes we have like things happen, but excessive use can really do a lot of damage to your gut health. And
If you took it from a short, a lot, that it would have like a long-term effect.
you need,
Like if there was a period of time you took a lot of Advil, let's say.
it could definitely, I mean, it could, yeah, definitely, like, like you would, so the good news is that there's a lot, like if you stop, there's a lot of things you could do to like help support, replenish, because then the other big one is like antibiotics. They wipe us out. That's why I always tell my patients, there's a one specific probiotic, Saccharomyces boulardii, that does not get killed by antibiotics. It's really important to take that while you're on an antibiotic to really protect your gut. Saccharomyces boulardii. Birth control also has a very negative impact on the gut. It actually is associated with Crohn's and ulcerative colitis, believe it or not. And this is like not like crazy naturopathic. Yeah, hormonal birth control. Sorry. Yes. Obviously, like with a method, it's not going to have an impact. So medications can, obviously we talked a lot about food. So first, like obviously, like eliminating things, increasing diversity of species, and then supporting your gut with gut supportive nutrients, things like glutamine, slippery elm, bone broths. All these can also have like very like healing properties. Yes, definitely. Okay, so that was a very dense. I guess I just can talk about this stuff forever. I don't know if we have time or if anyone has any additional questions, hopefully I can answer. Oh, yeah, so I have a really good, I came up with a really comprehensive, it's both like there's a detoxification protocol in it, but also just go through all the different toxins and like what to do about it. What are some of like the alternatives? So you can either email me. I'm also happy to take, people want to write their email address. I'm happy to email it to you. Yeah.
Like, different blood types,
Oh, the blood type diet?
Yeah.
the blood type diet, but also like in terms of like different blood types being able to handle and not handle their hormones.
Oh, that's a good question. So I mean, I have read the book, The Blood Type Diet, and I sometimes will like utilize some of that in my practice, but that's a good question.
It's like, how do you start on so
Yeah, of course.
I've gone to her and like I've told her like my blood type is B positive, and she always tells me that like, oh, B's can't handle their hormones. So I'm like wondering if
That's interesting. Yeah, I actually don't know. I'd have to really look at that. I actually don't know that.
I personally would just love to hear more about the synchronizing of both exercise and more of the vitamins that you were saying, like and also foods,
Right.
during each part of the cycle.
Yeah. So, okay. So if you think again, like the first part of the cycle being the estrogen needing way you handle it. And when I say soy, I'm not talking about like soy milk. I mean, definitely like these products.
Either they have an allergy, there's. So why is like one of these like, I sometimes find that we can use like.
For some people, but also at the same time, it can be hard. Like, as I mentioned, like Hashimoto's, most of those patients shouldn't have soy. And these are all like what we call like phytoestrogens. So they have like kind of like estrogen-like properties, but they're not like a xenoestrogen or like an endocrine disruptor. Also foods that are high in zinc. So pumpkin seeds are going to be beneficial. Vitamin E also, I mean, it just happens that it's E, but so like avocados would be really good at the first part of the cycle.
And that first part starts when your period ends or includes your period?
Basically, it starts so basically the everything, the first day of your period is basically when everything starts. Yeah.
So that's when you should be estrogen dominant, is starting from your first day.
Exactly. Exactly.
Okay.
And then the second half, which is like the progesterone, and so thinking about things like so sunflower seeds, sesame seeds are really good for that second part of the cycle. Also iron. So the big thing really is like the big push for iron rich foods.
And again, the second half.
Also evening
is-
primrose oil. The other big thing is like omegas. I'd say like definitely the first half of the cycle, much more like omegas.
Like,
Like omega-3s, like salmon.
salmon, eggs.
Some eggs, yeah, like if they actually have to say omega-3 eggs. So not all eggs are, and I can tell you exactly.
Automatically.
No, sorry. So do you know how they make omega-3 eggs? I can tell you. They basically feed the hens flax seeds.
Yeah, oh,
That's what
so
makes
funny.
it. So if they have like a high omega-3 diet, you're gonna have, so just because they're organic doesn't necessarily mean that they're gonna be omega-3 eggs.
Basically, not only are they $10 for regular, they'll be $15 for organic and $30 for organic plus omega-3.
Right,
That's
exactly.
where we're at.
Yeah.
So
Do your math now.
you said the second half progesterone dominant, that starts when? Like after ovulation?
Exactly. Yeah.
Okay.
So basically, it's ovulation that tells our body to start, or basically tells the ovaries to start producing progesterone. Otherwise, like the ovaries don't care about progesterone.
Okay, so omega-3s, vitamin E, zinc, that's all estrogen dominant, and then iron. I'm not really sure what the other ones are that you mentioned, but from those oil and sunflower seeds, what those give you
Mhm.
are progesterone.
Yeah.
So what do you say about seed cycling?
So that's kind of, yeah, basically, yeah.
It's more comprehensive. like you
Right.
said, than seed cycling.
Exactly. Yeah. So I do use seed cycling a lot in my practice.
Are there any other foods as well that you see, like specifically? Or just any of those?
I mean, those are the main ones. I'm trying to think if there's.
The foods?
No.
My question, I said, are there other foods like each?
I mean, then there's others like kind of like basic principles, like, definitely at the second half of our cycle, some women, specifically viewers, somebody who like tends more towards craving, it's really important to make sure that your blood sugar is balanced. So a big beneficial, it's like always I forget all these things. So another really beneficial food for the second half of the cycle is actually nutritional yeast, because it's very high in chromium. So chromium is going to be an important nutrient for the second half of the cycle.
Chromium, talk about it, drying them out.
Chromium?
Nutritional needs.
They're two different things.
What do you mean
Chromium.
drying them out?
That would be first.
Oh,
It's not what-
I know. Yeah, I haven't heard that.
No, I'm confused. It's chromium nutritional yeast.
So nutritional yeast is a high source of chromium.
Okay.
So actually, like a really good would be, having like about like anywhere from like 2 tablespoons to like even a quarter cup of nutritional yeast,
Nutritional yeast is like,
or throughout the day. Yeah.
Well, yeah, how do you get this?
bread.
Oh,
You have to buy, like,
You
it's
can
not
totally-
natural food.
You can totally get it.
You
You
can get it- you
can
can-
get Gahans,
it's
I
not
think.
natural food.
I think so.
If somebody has a more prone to yeast.
Oh, it's not related at all. Oh, you mean nutritional yeast?
Yeah.
It's inactive. It has no function. You know, like baker's yeast, that would be a problem, but not nutritional yeast.
So nutritional yeast, you can act that from just eating certain foods, you have to buy it.
It's a
separate.
food. Nutritional yeast is a food.
It's a food? I've never seen it, I do not know what it is.
It's
a Yeah. powder.
It's like
People add it to, like,
a little bit.
like, Yeah.
vegan.
It's amazing to put on your salad. So
Yeah.
if someone has cravings, you're saying this would be good to have in their second.
Yeah, having, yeah.
Is there anything else
Popcorn.
besides that?
So like kind of like a lot of like some of the basic principles are like, you know, really honing in on like balanced nutrition, really anything that's going to be avoiding like the things almost that you're craving are going to just make it worse often, because really it's basically your body's just like responding to like erratic blood sugar spikes. So really as much like blood sugar stabilizing as possible. So like protein, I mean, you know, iron rich foods. So that would be typically usually high. Oh yeah, yeah. So it's like estrogen, like I actually just did a video on this. I'm gonna sit down. What?
Maybe repeat the question, please.
Sure. I'm sorry.
You're good. Please sit.
Okay.
Can I get you anything?
I'll have this water. Okay, so estrogen tends much more towards like that like irritability, anxiety, sleep, yeah. Well, it could again, so sometimes it's also like sometimes it's like your hormones are completely different, like they're like normal, but just like the way your body reacts and how it like relates to like the different neurotransmitters. And in fact, actually, there's a type of seizure disorder that actually occurs at the higher estrogen part of the cycle. So are people familiar with neurotransmitters? What I'm talking about? Okay, so estrogen and progesterone almost they sometimes they call them like you guys know as they're like they have like neurotransmitter like property, and that's one of the reasons why in some of these women estrogen or high estrogen states can actually set off a seizure, which is kind of interesting. So estrogen is much more like excitatory neurotransmitter, like anxiety, high edge, irritability, that kind of feeling. Maybe we all recognize that one. And then progesterone is much more like on like the low depressive side. And I think a big part with the progesterone is just how it relates to serotonin. And it has like and like basically like a negative impact. You know, one of the things I forgot to talk about when I was talking about gut health is how like a lot of our serotonin is actually produced in our gut, and that's another reason why optimizing gut health is also important for
So what
hormone.
would someone do if they want to start like improving their gut health? What would you say is like that first thing to like?
Well, definitely eliminate anything that is going to be negatively impacting your gut. I think that's always the first start, like best to your ability. Building up the reserve of beneficial bacteria through like both like diversifying plant foods and either bringing on fermented foods or a probiotic. And then
One that's in the fridge.
yes,
Forever.
yes,
That means it's alive.
yes, yes. And as women, we always want to choose probiotics that at least have reuteri and rhamnosus, because this is also going to be beneficial for vaginal flora as well, which is super important.
What was the second one?
Rhamnosus. Yeah, so it's always important to have like also like female. I mean, there's actually that could also be another talk. I could talk about all the different strains of bacteria and what they do. But the other thing is, so if you suspect you have leaky gut or you know you have leaky gut, giving your body specific nutrients that are going to be supporting the gut lining. So number one is glutamine, and we actually even use glutamine for cancer patients undergoing chemotherapy. So chemotherapy affects like rapidly dividing cells, and actually the cells of our GI lining are rapidly dividing cells, so that attacks those cells when we don't want it. And glutamine can help, actually taking before even starting chemotherapy can help. Other like also N-acetylglucosamine, NAG is very important, slippery elm, marshmallow. So slippery elm is what we call a demulcent. So it's like demulcent are any of these herbs that kind of like are like, they're kind of like mucusy because there's kind of like slime, slippery, like, yeah. So they help to like moisten. Typically, usually in a powder. I mean, they also have it in tincture form, but usually, so often like there's like some like pre-made blends where it'll have like glutamine, it'll have like slippery elm, it'll have marshmallow, it'll have DGL. So DGL is a type of licorice that has a component of it removed. So the problem with licorice is it can increase blood pressure, but you don't always want that. But like licorice in itself is very calming for the GI tract. Cat's claws, another herb that's good for the GI.
What are your thoughts on kind of like these like blends and stuff that like, you know, I see a lot of times like on Instagram, like they're like, oh, like here's like all the vitamins that you need to take to like improve gut health, and then it's like you can put them all in like one pill. Are those things like reliable, or is it better to take the individual?
Right, this is a good question. So, okay, so there's a lot to unpack there. So one, like, where is like the company, like what are, like, how are they sourcing things? Where are they getting, like, so like when I'm like coming up with a plan for my patients, these are the things I'm thinking about. Like, first of all, like what gut nutrients specifically for you would be, so there might be some things in that blend that would make sense for you, but we don't know the quality. Like, so I would have to kind of know more about that individual.
Like that individual blend that they're
Right. And then like, cause like sometimes also like I'll find like a blend and it wouldn't work for a patient because it might have something in it that isn't going to benefit them either.
You talk, so you're saying, so progesterone would be more focused on the gut and estrogen you're focusing on.
Oh no, both of them for the gut. I mean, what do you, oh, sorry. I'm talking more from like, because of serotonin. Yeah.
No, I'm saying you said progesterone sounds like it leads more like a some kind of imbalance. Sounds like it leads more to depression, could be symptoms of, while
Right.
estrogen could be more anxiety and irritability. You said?
Exactly. Yes.
So you said focusing on gut health to help with progesterone.
Well, let's say gut health for both. The other thing I'd say for like, you know, depressive moods around the cycle, you know, the other big thing we want to look at is B vitamins, because basically, again, like if we're thinking about, so we're thinking a lot about like the impact to the neurotransmitters in response to the progesterone. So we want to think about, okay, so how can we support dopamine? How can we support norepinephrine and serotonin? And a big part is going to be B vitamins. Also, like another big part.
Again, this is for both of them or just progesterone? Keep saying progesterone, not estrogen.
So when we're talking more about like this like depressive like symptoms of like progesterone, I'd say like either progesterone excess or just like how our body is affected by progesterone.
Right.
Okay.
So I'm asking, what about estrogen?
Okay. So meaning, sorry, like, irritability, what are some of the, so like definitely magnesium. Also the big thing, typically, usually it always is, it comes back to like estrogen dominance and like where the estrogen, why is it dominant? And typically has a lot to do with how it's being metabolized by the liver. And so that's where something like I said, like cruciferous vegetables, like broccoli, kale, etc. But there's a component of cruciferous vegetables, DIM, which helps with the detoxification. Also, another is calcium D-glucarate, which I don't know if it naturally occurs in any foods, but definitely just increasing. It's called calcium D-glucarate. I don't know if it actually does naturally occur in foods, but definitely like getting a lot of cruciferous vegetables is going to help with the detoxification, or taking the DIM, but definitely magnesium is typically usually. So I'll I'll cycle magnesium where I'll have a lower dosage at the beginning of the cycle and then like a higher dosage at the second half. Specifically, yeah, specifically if there's like a lot of irritability and like cramping.
And which magnesium was good for that?
So I usually like to do a blend
Okay.
because then I can kind of have like, I like a little bit of malate, more for like the muscles, and I like the glycinate more for like the mood stabilization. Also, like some women also have like bowel changes around their menstrual cycle. So these are all kind of things that I would consider.
Do you ever recommend magnesium for skin, like Epsom salt?
Yes. And also there's also gels.
Epsom salt?
Yeah.
It's a bath, Epsom salt bath is magnesium. Do you find that it's better absorbed in the skin than orally? Because I've heard of that, and that's why I know one herbalist recommended to me to take Epsom salt baths rather than taking magnesium.
Well, they all actually, that's another, so they all have like different absorptions, and that's why if you like look at a magnesium, you're like, oh, why is this one only 100 versus this one is like 350? So for example, like citrate oxide are not as bioavailable, and that's one of the reasons why they do help with bowel movement, because they're not as bioavailable, versus something like glycinate is a lot more, and then like L-threonate, very bioavailable.
What's bioavailable?
Oh, more like your body's ability to utilize the nutrients. So like basically when you take, like there's always going to be something lost. And so how much do you need to like how much you have to intake in order for the body to use it? So something that's very bioavailable, you don't need as much either. And often like it might be like altered in some way. And that's where like, again, like the various types of magnesiums being connected to various different substances having different ability to be assimilated in the body.
You said about bioavailability. What about like prenatal vitamins? Like, what's your take on that? Like, should, in general, take them, not take them, should you do more
Like
specific
prior to
on
pregnancy or when you're pregnant or both? Well, first,
And are there any specific brands that you say yes take, not take?
yeah, absolutely.
Are they generally bioavailable during pregnancy, or is it like?
So it almost like to her first question really depends on like the brand and like the form and things like that. So I would say anyone who is thinking about getting pregnant.
Kinds of folate or something?
Yeah, so okay, so like, okay, a couple of things about that. So you always want to be actually supplementing with the nutrients at least like 3 months prior to getting pregnant. If you start supplementing once you're pregnant, you're actually like too late. That's specifically when it comes to iron, folate, and iodine. When it comes to folate, I always just across the board always just recommend the activated folate, which is the MTHF, the methylfolate, because about like 15% of the population don't readily activate it. So might as well just always do the activated form. Where again, like I feel like, so like in my practice, like I guess because like I'm so used to like very like patient specific specialization, to say like like everyone is going to need, and I'll even like say prenatal in air quotes, because I kind of like create my own prenatal. I mean, not that like I make them, it's just like I will tell the patient exactly which nutrients to be taking and in what forms. I mean, one of the problems is like some of these prenatals, you have to like, you almost like have to like really do your research, because they don't always have like the right amounts. They might not be in the right form.
So you recommend kind of like working with someone before planning on getting pregnant? If you
Oh,
wanna-
definitely. And even like during. The other thing too is like for example, iron.
I'm just saying that not everyone can, we were having a short discussion about like everyone taking prenatals, and like not everyone can go to that specific level. So like there's
Right.
a balance.
Right.
What do you
So
mean can't go to that specific level in terms of-
Meaning every single woman that wants to get pregnant, not all of them can or know to.
right,
Get an
exactly.
appointment with IV. And
Yeah.
do all the blood work and saliva, spit, and
Yes.
all the pieces. So like
So they're just taking a standard.
Well, first off, like when it comes to like iron, I only actually, even though I said like how important iron is, I only recommend iron if there actually is low iron. And because iron actually is one that you can actually take too much of, and that can be problematic. Similarly, vitamin D. I only recommend vitamin D if it's actually low. And like low is like I'd say in air quotes in that in order to get pregnant, like you need to vitamin D level. So both like vitamin D level needs to be at least 50, and ferritin, which is a marker of stored iron, needs to be at least 50. So if they're below, either vitamin D, you probably usually have to typically supplement. It's not, you're not really going to really get it from food nor the sun. Iron, on their case, depending how low it is, I might just recommend increasing iron foods and giving more education around how to optimize iron. I mean, one of the benefits of kosher is that we don't mix dairy and milk. I mean, I'm sorry, I mean, me and dairy. So like, because calcium-rich foods actually impact iron absorption. So it's kind of interesting.
That's actually one of my tricks that whenever I'm checking it prenatal, if it's equal iron to calcium, I'm like, "Meh." But lately,
Also, there should never be a calcium in a prenatal. I'm sorry. There's just certain things that should not be. Magnesium really does not belong in a prenatal. I typically actually, when I'm really working in depth with patients, I usually have them have like a multi-mineral. If they needed an iron, if they're not getting enough from food with the calcium, I might have them do some supplementation with calcium. I'll have them do a B complex. Typically, usually I'll always do vitamin D, and then choline and omegas. So that's typically usually what I do.
You're saying 3 months before getting pregnant is when you should start prenatal care,
Yes, definitely.
not more than that.
I mean, it could be even more than that. I mean, you can definitely
I
start.
think if someone's having regular cycles, it's good
Oh,
to
yeah.
start 3 months, it's good to start before 3 months before.
Yeah, I mean,
Irregular, I know what I said.
Oh, but I'm
Yeah.
saying starting someone who's having a regular cycle.
oh yeah, you definitely want to be starting before. And I guess it also like it depends on your age. So like I do also work with women who are trying to get pregnant in their 40s. Like definitely they really benefit if they start working with me at least like 6 months before. And again, like sometimes it's good just see one of the hard things is that sometimes like you don't get a thorough workup and you might run across like that you might have one of these issues. And if you had done a more of thorough workup, dealt with that first, like specifically thyroid's a big one when it comes to fertility. And there's a lot that can be done, but like again, like you're just like basically delaying things out more and more. And so like the more that you can investigate, the
But
better.
The thyroid issue you would know that you have because you have other symptoms, or is it something that you only see like when it comes to fertility?
No. Well, so okay. So many people who have thyroid symptoms have no idea that they have hypothyroidism. And also what's interesting is some people have symptoms of something and they don't even know they have symptoms.
Oh, because there's sometimes like
Yes.
well,
I'll have 2 patients with constipation, right? So one patient is coming to see me because they have constipation. The other patient, I tell them they have constipation. They had no idea.
yeah.
This happens all the time. Even like sleep issues. Like I'll have somebody who's like coming to see me because they have sleep issues. And then another person, I'm like, you have this problem because you have sleep issues. And they're like, I have sleep issues? Right.
I know it's like just a quick question, let's say with exercise. When would you say is the best time to increase? Like if you want to try to push your limit and get better at something, when is like also the best time to step back?
said before the morning, you said it's good for.
Yeah, no, but
Yes.
also in the cycle.
In the cycle, again, there is like definitely, I wouldn't say like there's like a cut and dry rule because everybody is a little bit different, and also like what kind of exercise you're talking about. I mean, you're definitely is the problematic, really the bigger problematic things with like the second half of the cycle is one, the bleeding, and also laxity.
You said the bleeding when
You're leading up towards the bleeding, plus also more laxity. So I didn't really talk about this so much. So one of the other functions that progesterone does is ligament laxity. So like I'm trying to think of like how you would like relaxation of. That's one of the reasons, why birth control pills, one of the side effects is actually acid reflux, is because of the progesterone actually releases the sphincter. So you're gonna be a little bit more potentially accident prone at the second half of the cycle because
like you're more loose. like, it's not
exactly.
concurrent, like us.
Right. Yeah. So that's just something just to be
Leading up.
right. Yeah. So like more ligament laxity, more bleeding. Actually, another thing, dentists, I don't know. I only heard this from one dentist. I have to like research this, but he was saying actually the second half was like, oh, because of progesterone, you're also having more inflammation. And so more bleeding gums when doing procedures, dental procedures.
Are
Yeah.
women also more fatigued?
Yes. Yeah. So it's
it
just
is
things,
harder to-
right.
It's also interesting because your body kind of tells you, like, before your period, you're not so like up to like going to the gym and like working out, as opposed to like mid-cycle, you're like, oh my God, let's go. Like, do
Yeah. And
this.
part of it's like also like listening to, like the more we listen to our bodies.
That's the whole cycle syncing it's kind of like bringing you to the awareness of like the natural cycle of your body. So,
Right. Exactly.
yeah.
So, but I'm saying, so the second half, the first half starts the first day of the period, so does the energy actually increase like sometimes the first day of the period?
Yeah. For some people, I mean, I definitely have some patients where like once your period starts, they're like, oh, I'm like
Really?
Yeah.
back to life
I
now.
have that sometimes where like leading up to it, I'm like so like whatever, and then like I get my period. My first day is hard just because of like cramping and stuff, and then like the second day I'm like, I'm not coming back to myself. Like,
Yeah.
yeah. Hormones keep our lives.
So you could exercise and send you in group period, like it's not.
Yeah. Yeah. Again, like there's not like any, like, I feel like everyone is so different. Like there's not like a kind of,
I feel
yeah.
like
Cycle syncing is exercise. I've seen that.
Isn't it into like getting in tune with your cycle?
Yeah, but
So
it
you
talks
feel
about how like once you start your period, you should like rest.
Because for most women, that's what they like.
Right.
But not everyone is, you still actually still listen to your body.
Mhm.
Do you work with women's like women who are charting their cycles? Like we talked about basal body temperature and cervical mucus. Like,
Yes.
do you work with women's charts?
Yes.
Like, yeah.
Oh,
And
and
what information does that give you? And seeing a woman's chart.
so it does help a lot as far as like, because like again, I really want to know if a woman is ovulating.
When she's ovulating.
Right. Exactly. So like,
How
'cause-
long each phase is.
right, and it helps like, I mean, there's so many things like that it can like, I mean, again, specifically with helping women get pregnant. And honestly, the best book out there for that, like if people really want to learn more, is Taking Charge of Your Fertility. It's on, you can get it on Amazon. It's fine. I have a copy and I'm like, did I leave it in my, I'm like been like looking for it because like it's like another book I really like. And
Is
it's
that like for people that are doing like the NAT, like that type of like birth control, like fertility awareness.
so there's, I just think every woman just should have this book because it just like explains almost like everything that I explained, but even better, I think. So it can be useful for both like women trying to get pregnant, women trying not to get pregnant. Sure. Oh yeah, of course.
You know me, I
Yes.
have to do my
No,
part
it's
of the
good.
quality training. I'll say it nice and loud that even something like this would require a conversation with a rep.
In terms of what?
In terms of avoiding pregnancy.
Oh, sorry.
somebody
Yes,
is-
yes.
If somebody is tracking their cycle for the purpose of avoiding pregnancy,
Oh,
it's a
right.
conversation
Yes.
to have with them. It is not, it doesn't mean the rub is gonna say no, or it's impossible, but it is a conversation to have with the rub, just like any other contraceptive. is
What
part
other
of-
books would you recommend?
But if someone's tracking it,
Yes.
for single, just to know what's going on with her.
Oh, yeah.
The purpose of
I think the other books.
then it is a conversation, just like taking a pill, just like using a diagram, just like. We're gonna have a nice talk about this.
So, and when you're thinking women's cycle, will that like into your chart? Will that?
Sorry, if having children is a mitzvah, so in order to prevent the act of doing that mitzvah, it's a conversation with her. Yeah.
Yeah.
Just like a bris, if you're skipping a baby's bris on the 8th day, there's usually a reason for that. If not, the baby should have a bris on the 8th day.
Yes.
So.
What other books would you recommend?
And just back to my question, if that's okay, so just in terms of health and just how our fertility is doing, and you're looking at a woman's chart, will that give you clues about which hormones to look, like which hormones you wanna take a look at?
Yeah,
Just from
yeah,
terms of-
definitely. Yeah, yeah, yeah. Oh, anything by Aviva Ram. Aviva Ram, just all her books. Aviva Ram.
Jill Rom,
Aviva Ram.
how do you spell that?
Aviva, Aviva.
Is her name Aviva Jill Rom?
Probably.
her?
I don't know her middle name. That's funny. She looks so different there.
Oh, wait, here's a better picture.
Yeah, that looks
That
like
her?
her.
Okay.
Yeah.
Oh. Okay, so any book of hers.
Hi.
Oh, very cool. Okay, so she has about like hormone intelligence.
Yeah. That's why I mean her website's so great. Aviva Ram.
Does she also have about like kind of gut health and like?
Oh yeah, she talks about everything. She also has a great podcast.
Yeah.
Yeah.
Thank you.
Yeah.
Do you know what it's called?
On health.
On health? On health?
Yeah, on health.
With an O or U?
On like
On
on,
health. Oh, on?
on health.
Oh, on health.
I think that's what it's called
I'll
actually.
look her up. Aviva Rom. She has on health.
Mhm.
It's called.
You find a lot of links between, because we like, again, like with the gut health and depression and potential.
Thank you very much.
Together a lot.
Yes.
Yeah.
There's definitely.
We have a tradition that we take a selfie with our speakers. Anybody's up for it.
We should all come around.
I was gonna say, you guys
Yeah.
can come around over here, but.
Oh my gosh, I need it for the selfie.
Yay! Thank you.
Thank you.
Thank you. Thank
Yeah.
you. Thank you.
I'm just hoping my